I want to start with something personal. There's a specific kind of morning when it hits you. You're not even fully awake. You walk past the bathroom mirror and you catch a glimpse. And for a moment, you don't recognize yourself. For 30 years, the medical establishment's answer to pattern baldness has been essentially the same. Slow it down, manage it, accept it. 2 drugs have been FDA approved in that entire time. Minoxidil, first approved for blood pressure, repurposed for hair because people noticed it made hair grow as a side effect. Nobody fully knows the mechanism to this day. Finasteride, a hormone blocker that works by reducing DHT, effective for some, but associated with sexual side effects for others, sometimes persistent ones. And neither of them reverses hair loss. They just slow the clock. That biology, finally, is beginning to be understood. And the understanding has led somewhere remarkable. It started not with a drug, but with a question. A simple, beautiful, almost naive question, asked by a research team at UCLA, led by Dr. William Lowry. Not, how do we block DHT? Not, how do we improve blood flow to the scalp? But, what is actually happening inside the stem cells of a dormant hair follicle? What is the biological difference between a follicle that is growing and one that has gone quiet? The answer, when they found it, was metabolic. It was about energy, about how the cell was burning its fuel. In an active, growing follicle, the stem cells are running on glycolysis. They're burning glucose fast and producing lactate as a byproduct. In a dormant follicle, they've switched to the slow, efficient burn of the mitochondria. And that lactate, which sounds like a waste product, turns out to be a critical signal telling the stem cells it's time to wake up and grow. The UCLA team, building on this discovery, published in Nature Cell Biology, designed a molecule that could force the switch back on. They called it PP405. It blocks a protein on the mitochondria called the mitochondrial pyruvate carrier. When blocked, the cell can't burn fuel the slow way. It shifts to glycolysis. Lactate rises, and the dormant stem cells get the signal they've been waiting for. The clinical trial started in 2023 with a phase 1 study. Safe, well-tolerated, no drug in the bloodstream, it stays in the scalp. And the stem cells, confirmed by biological markers, started waking up within a week. Phase 2A followed. 78 adults, double-blind. Nobody knew who was getting the drug and who was getting a placebo. 31% of the men with the most advanced hair loss, people who had the most to lose and the least reason for optimism, grew more than 20% more hair in just 8 weeks. Not thin, wispy, peach fuzz hair. Thick, pigmented, terminal hair in areas that had been bald. For the first time, we have clinical evidence that dormant follicles can be reactivated and that real hair can grow back in places that seemed permanently lost. I want to be careful here because this story deserves care. PP405 is not approved. It's not available. Phase 3 trials begin in 2026 and won't conclude until at least 2027. FDA approval, if it comes, is likely 2028 or 2029 at the earliest. And it won't work for everyone. If a follicle has been so severely miniaturized or the scalp tissue has scarred, the follicle may be beyond reactivation. The earlier someone starts, the more follicles remain to reawaken. But I also want to be clear about what this represents. This is not another incremental improvement on minoxidil. This is not a supplement company's marketing. This is a decade of peer-reviewed science from one of the world's great research universities, confirming a mechanism and validating it in human trials. With a $120 million Series B from Google Ventures and Arch Venture Partners, people who do not write checks on hope alone. I started this by talking about a moment in the mirror, about something that changes slowly, then suddenly. What I find quietly remarkable about PP405 is that the science is giving something back that we thought we'd permanently lost. Not just hair, the biological possibility of it. For the first time in 3 decades, that morning in the mirror might have a different ending. Follow for Phase 3 updates. Full deep dive article in the description. Written, referenced, no hype. Share with someone who needs to know about this.